All right, joining us now, former FDA Commissioner Dr. Scott Gottlieb. It's great to have you on. There's a lot to talk about, Dr. Gottlieb. I want to ask you about the COVID cases, not only topping 2 million, that number, but the assessments that we might have up to 100,000 deaths, possibly in the next few months, and resurgences and increased hospitalizations. How would you assess where we stand with the virus right now?
Thank you for having me. Well, look, we have continued spread. We have not quelled this epidemic, and the epidemic's continuing to expand, but it's expanding more slowly than it was. So the doubling time right now is about every 60 days. And so we're going to continue to have cases. I think the overall death rate's going to come down even as the cases continue because we're learning how to treat people much more effectively. So we're preserving life much more effectively. But, you know, this epidemic's expanding. If you look at the doubling time of every 60 days, by the end of the summer, we're probably going to have an epidemic where 10 to 15% of the U.S. population has been exposed, and there'll be many more deaths from COVID-19. The states that right now have outbreaks underway, Texas, Arizona, South Carolina, North Carolina, Georgia looks hot right now. These aren't states where they quelled the epidemic and this is a second wave. They never really got through the first wave. They've had this slow burn of infection, and now they're having a resurgence. And in some respects, that seasonal effect that we talked about may be working in reverse in these states. It's 100 degrees in Phoenix right now, 95 degrees in Houston. So people are being driven indoors more, so you're having more congregate settings inside, and that could also be contributing to the spread.
So, Doctor, what impact are we likely to see from the mass protests over the past several weeks? Obviously, as Willie said, it's a righteous cause. It's a cause for the rights of black men and women across America. At the same time, it is black people who are disproportionately impacted by COVID-19. What concerns do you have? And do you believe that those concerns could be mitigated by the fact that the protests were outside? We saw a lot of masks in the crowd. And there was at some point, as we saw in some of these scenes, not here necessarily, some social distancing taking place. What are your concerns? What do you think the overall impact of these protests may be on infections and deaths in America?
Right, and the protesters were driven to take the actions they did based on the injustices that are pervasive in our society, including hitting people disproportionately with respect to COVID-19. And people took those protests recognizing the risk. You saw a lot of mask wearing in those groups. But notwithstanding those facts, there's going to be infections coming out of those large gatherings, probably less than if they were held indoors, certainly. But you figure the prevalence right now of infection in the country is about 0.5%, so 1 in 200 people. About half of those people roughly are probably asymptomatic or pre-symptomatic, so they're out and about and capable of spreading the infection, perhaps less efficiently, but they're capable of spreading the infection. So you can do the math on how many people were within those crowds, probably with COVID-19 at risk of spreading it. So we will see infections coming out of those mass gatherings. How much, we don't know, and it's going to be hard to fully isolate that effect because we're seeing cases go up across the board in large cities. And so it's going to be hard to tease out what impact the gatherings had, these large protests had, relative to just some of the slow burn of infection that we're seeing across the country right now.
And obviously, Doctor, a lot of people were concerned about and confused by what they heard from the WHO doctor talking about the asymptomatic spread of this virus. Can you just clarify for people about if they saw the news from that press conference about how COVID-19 does spread asymptomatically?
Well, there's clear evidence of asymptomatic spread and also pre-symptomatic spread. And so you have to distinguish the two. Asymptomatic spread is people who never develop symptoms. Pre-symptomatic is people who aren't yet symptomatic but capable of spreading. And in fact, you may be most contagious in the pre-symptomatic stage. The studies have shown that the time at which you're most contagious on average is 0.7 days before you develop symptoms. So people who are asymptomatic and go on to develop symptoms are also highly contagious. There's pretty good evidence now that there's asymptomatic spread. I think the statement by the WHO was premature, and they were basing it just on contact tracing that they were seeing done in China, which is an unreliable tool on which to draw such a conclusion. I think it's going to take better data to really nail down what the proportion of asymptomatic spread is. But we've seen cases of spread in homeless shelters where there's a lot of asymptomatic spread, or spread on those aircraft carriers where there's a lot of asymptomatic spread, to draw the conclusion that there certainly is a contribution from people who are asymptomatic, never go on to develop symptoms, who are spraying this virus. And that's what's so concerning. It makes it so efficient in terms of its ability to spread in populations.
Dr. Gottlieb, it's Willie Geist. Good to have you on again with us this morning. I think you probably see and hear the same thing I do, just anecdotally, which is that after 3 months of stay-at-home orders, people who are naturally social beings are starting to go out again. They're sometimes responsibly, sometimes not responsibly, but they've kind of said enough. It's summertime. We're going to go out and start experiencing life again. What would you say to people who feel that way, people who are going back out into the world, maybe relaxing some of their own personal restrictions they've had on themselves? It did feel like once New York calmed down a little bit from those days of crisis where there was no PPE in the hospitals, hospitalizations and deaths are down there at the epicenter of this crisis, that people maybe let their guard down a little bit and said the worst is behind us. What's your broad view of where we are in this and how people should be thinking about it this summer?
Well, look, I think that this is going to be a long haul. I don't think we're going to get COVID-19 really fully behind us until we have a vaccine. And even then, this may become a second flu season that we need to contend with. And we're going to have to deal with one more cycle of this in the fall and the winter before we can get to mass inoculation of the population. And that's in the best case scenario with respect to the technology. So we can't let our guard down. We're going to have to contend with this. Universal mask wearing is effective, especially higher quality masks. People need to be conscious of their hygiene, their hand hygiene. I think people need to try to shrink down their social circles a little bit and try to take fewer trips to the store. All the things that you could do to try to limit social interactions while still going out and about and re-engaging in more normal activity. Those things can reduce spread if they're practiced on a widespread basis. In many respects, I think we had to lift the mitigation steps. People were demanding it. I don't think we could have implemented them much longer. But many states, when we did this, most of the states that did it didn't meet the criteria that was laid out for when we would lift those mitigation steps. But I think we had to do it. The policy really followed what the people were demanding in the same way that the policy followed what people were demanding when we shut down the states. I mean, people say that the public health officials and the political officials made the decision to take those population-wide mitigation steps. It really was the people that demanded it. The White House and political leaders didn't shut down the NBA. The NBA decided to shut down the NBA when they saw what was happening. And so the policy really has followed what people have demanded based on their fears and their desires in these instances.
Former FDA Commissioner Dr. Scott Gottlieb, thank you so much for being on the show this morning. We look forward to talking to you again soon. And coming up, we'll have more on the concerns that the protests could lead to a sharp spike in coronavirus cases. Also ahead, the emotional testimony on Capitol Hill from the brother of George Floyd before lawmakers urging police reform. Plus, President Trump comes out against an effort to drop Confederate names from military bases, even after some military officials said they were open to the move. Morning Joe is back in a moment.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.